Today we are talking about a really high-tech procedure for chronic pain called radiofrequency ablation. Now, you might have heard people call it nerve burning, which sounds, a little intense. But by the end of this, you'll see it's way more precise and a lot less scary than that. It's really about safely and accurately hitting pause on a faulty pain signal. So, let's get into it.
But first, let's just start with a huge question. What if? What if you could find the one single spot where your chronic pain is coming from and, with a really targeted procedure, just turn it off, at least for a good few months? I know, it sounds a little like science fiction, but that's pretty much the core idea behind this technology.
And this is for a very specific kind of pain. You know the kind I'm talking about? It's that one spot, maybe in your back or your neck, that just refuses to go away. You've tried physical therapy, you've tried medications, but it's still there. It's that stubborn, nagging pain that really needs a much more focused approach.
To figure out how we can target it, we've got to understand what's actually going on. So let's reframe how we think about this stubborn pain.
Okay, so let's use an analogy here. Imagine your entire nervous system is like a super complex electrical grid in a house. Now, a chronic pain signal, that's kind of like a glitch from one single faulty wire that just keeps sending an error message over and over again. The goal here isn't to shut down the whole house, not at all. It's to find that one specific wire and just fix the signal.
So how in the world do you find that one faulty wire? Well, it all comes down to one word: precision. This isn't a guessing game. It's a really careful, step-by-step diagnostic process. And here's the most critical first step, and it is non-negotiable. Before a doctor would even think about radiofrequency ablation, they have to confirm the exact source of the pain. They do this with diagnostic injections called medial branch blocks. These are just temporary numbing shots to test the theory. If they block a specific nerve and poof, your pain gets better, well, they've found the culprit. In fact, it's standard practice to get at least 2 positive blocks before even considering moving on. Okay, so we've found the nerve. Now for the really cool part: how does this technology actually work? Let's pull back the curtain on the science here. This is the key. A special probe sends out a high-frequency radio wave. This makes all the little particles in the tissue right at the tip of the probe vibrate back and forth really, really fast. All that movement creates friction, and that friction creates a tiny, very controlled pocket of heat. It's this heat that interrupts the nerve's ability to send that pain signal up to your brain. And that's all ablation really means. I know it sounds like a heavy clinical word, but it's just the medical term for creating a very small, very precise lesion on that nerve using targeted energy. The whole goal is just to disrupt that one faulty pain pathway. That's it. And there are actually 2 main flavors of this. You've got thermal RFA, which uses continuous heat, around 80 degrees Celsius, to create that lesion. But then there's also pulsed RFA. This one uses short bursts of energy at a way lower temperature, around 42 degrees, which isn't hot enough to destroy tissue. Instead, it's thought to kind of reset or calm down the nerve signaling. Both are super controlled and used for different goals. So let's shift gears and talk about the procedure itself. What does this actually look and feel like for a patient? The entire process is built from the ground up for safety and precision.
It really breaks down into 4 simple phases. First, the area is completely numbed up with local anesthetic so you're comfortable. Then, the probe is guided into place using live imaging. After that comes some really crucial safety tests, and only after everything checks out is the actual treatment delivered.
That second step, the placement, this is where the high-tech stuff really comes into play. Doctors use a live X-ray, called fluoroscopy, to guide that probe. They're watching a monitor in real time, just like this, to make sure the tip is placed with millimeter-level accuracy, right where it needs to be. So what exactly is fluoroscopy? Well, the easiest way to think about it is like an X-ray movie. It's not just one static picture. It's a continuous video feed that gives the doctor a live look inside your body. It's all about ensuring incredible precision and, of course, safety. Now, before any treatment is delivered, there's a vital safety check. And here's the really important part. You are an active participant in this. You'll be awake enough to give feedback, and your feedback is actually a key part of making sure the probe is in the absolute perfect spot. So there are 2 quick tests. First, there's a sensory test. This sends a tiny electrical signal that you'll probably feel as a tingling or pressure right in that familiar spot where you have your pain. That's a good thing. It confirms the probe is on target. Then there's a second motor test. This one makes sure there are no muscle twitches, which confirms the probe is safely away from any nerves that control your muscles. Okay, procedure's done.
So, what happens next? Let's talk about what recovery looks like and, most importantly, the timeline for when you can expect to feel relief.
It's really important to set the right expectations here. For the first few days, yeah, you'll probably have some soreness where the needle was. That's totally normal. But the real pain relief doesn't happen overnight. It usually takes about 2 to 3 weeks for that nerve to really quiet down, and that's when you start to feel the full benefit.
So the big question is, how long does the relief last? Well, when we look at the evidence, studies show that a single, successful procedure can give you sustained pain relief for anywhere from 6 to 18 months. The reason it might not be permanent is pretty simple. Nerves have this amazing ability to slowly regenerate over time.
And that brings us to our AIIMS Insight for today. If you take away just one thing, let it be this: precision is everything. The success of this entire procedure rests completely on the foundation of a correct diagnosis. Without confirming the source of the pain first, you're just taking a shot in the dark.
Because at the end of the day, the goal here isn't just about getting a lower number on some pain scale. It's about getting your life back. It's about giving you enough relief so you can get back to physical therapy, back to your hobbies, and back to doing all the things that pain has been keeping you from.
So, to wrap it all up, radiofrequency ablation is a high-tech, minimally invasive procedure. It's not a shotgun approach. It's designed to precisely target very specific pain signals. Safety is literally built into the process with live imaging and those stimulation tests. And for the right person, it can offer real, long-term relief.
So, is this high-tech approach a potential next step for you? Well, the whole point of this explainer was to give you the knowledge you need to feel confident starting that conversation. The only way to know for sure is to talk to your doctor and ask if radiofrequency ablation could be an option for your chronic pain. Thanks for joining me.